start with our vendor?
Yeah, is there anybody online? Hello? Okay, so Arvind Pal Singh, Chip Coordinator, Union District.
Christy Albertson, Grant Writer from the Health District. Rochelle Hanson, Food Board.
Cecilia Montgomery with the auxiliary and also private citizen.
Diane Clay, Hospital Auxiliary and Lake County Food Share.
Maddie Bunton, nurse on the acute side and OHSU student.
Noni Moss with the senior center.
And Mark Sharp with the senior center.
Paul McGinnis, Greater Oregon Behavioral Health and the Eastern Oregon Coordinated Care Organization.
Charlie's right on the CEO here, but I'm also the chairperson of our Community Advisory Council.
Larry Coulter, I'm the Administrator in Training for Lakeview Gardens.
And Robert?
Yep, okay. Robert Meredith, Lake County Examiner, running the camera till Jimmy gets here.
Great, thank you, and thank you all for being here. Maddie, I'm glad to have you here. So, is there anybody on the phone?
Yeah, Alan Blood.
Oh, welcome, Ellen. Appreciate it. And
Cindy Bentley, Advantage Dental.
oh, good, good. And do you want to introduce yourself real quick now that you're here?
Sure, I'm Alana with the Eastern Oregon Healthy Living Alliance.
Excellent, thank you, thank you. To get out the housekeeping parts, should we, has everybody had a chance to look at the minutes of our meeting, the last meeting? And if you have, take a few minutes just to look at it quickly. In case anybody has forgotten, there are cookies out in front of you or here.
Yeah,
Don't
there's a
hesitate.
Beth them around there.
So I'd like to ask if anyone would like to make a motion to approve the minutes.
I make the motion to approve the minutes.
Thank you, Cece. Do I have a second?
Yep, I'll second.
Thank you, Diane. It's been moved and seconded. All in favor, please signify approval by saying aye.
Aye.
Any opposed, same sign. Thank you.
Brief addition to the agenda.
We have an addition to the agenda.
Yeah, just EOCCO report on the new waiver.
Excellent, excellent. Is
I
any
can
problem?
do it at the end.
Oh, okay. So we'll add that to the agenda. And we hope you're feeling better. That coughing is hard. This is not the best of seasons for that. Arvind, would you like to start off on the updates?
Good afternoon. Before I start the chip updates, Mr. Rod Howard came by my office in the morning. He's the older adult behavioral health specialist. And he told me to distribute these flyers that you'll have in your packet. And it's a free ride program which is organized by the EOCCO for the year 2017. If you turn over to page number 4, I just thought I'd share this interesting information. So if you turn to page number 4, under the how it works category, in the second paragraph it says the program provides free rides to EOCCO members in the following counties. And then they say they also serve OHT fee for service members in these counties except for Lake County. So that's interesting. I'll keep you guys posted with any more updates about that.
They might want to mute.
Yeah. And on the other side of the page, you can see the contact number. And on the other side of the page, you can see the contact numbers for various counties. And yeah, so I'm just interested if we call the toll-free number, how they're going to provide the service to Lake County. Oops, hello? There's a lot of disturbance coming from one of you guys. Could you put it on mute if you don't mind? Thank you. Yeah, so that's that. Coming to the chip updates.
So if
Wait,
you,
one question.
yeah, if you remember, Dan Schwanz came down and provided information on the non-emergency medical transportation program. So essentially, it's a call center. The phone call goes to the Mid-Columbia Council of Governments, but then they contract with local people if they're able, and I believe.
Andrea, don't they contract with you, is that why?
We're still working on it.
We're working on it.
So,
They're not helpful to, is there something we
no,
can do to help?
no. We had an ODOT audit, and having never been through an ODOT audit before, there were some things that needed addressed, so we're getting that cleared up before we take on yet a third program, because we do ODOT, the veterans, and this will be our third transportation program. So we're still in communications with them, we're just not ready to say, yeah, we're ready to go live. So,
But they will, you know, if need be, have someone from Clallam County that's under contract come over and get people to the places that they need to get. The reason that this came out, it just occurred to me, I remember Dan telling the two LCACs that I work with that they were waiting approval from the Oregon Health Authority that this document met the requirements in terms of language and readability. And, you know, so it was probably several months in the process of getting approved for publication.
and there's also a local gentleman that drives for them.
So, yeah, and we looked at the rides, and, you know, there are certainly people using the program. It was a little bit below the norm, if I remember right, in Lake County, but, you know, certainly people are using it. And the issue on the fee for service, boy, it's a really small number of people. Most of the people on the Oregon Health Plan in Lake County are EOCCO plan members. So I don't know what they'll tell you about why these people are fee for service.
Under the OHP plan?
Yeah, how they're not already assigned, so I don't know what that means. I can check into it too.
Yeah, and again, it's for non-emergency transportation only, right?
Right.
So, yeah, I think they'll have to make an appointment way in advance. Yeah.
Couple days.
But that's a big benefit to people that need
All right.
service. Yes. And that's really important. Good.
Should I move on to chip updates?
Please.
Any other comments? Okay. Coming to the youth health advocates, so we are officially done with the program. It's being completed. But I guess we can call it partial success, because so we conducted all the classes in Lakeview. We got the student surveys and the advocate surveys back for the Oregon State University Extension Office to work on, and so that's a plus. But at the same time, for North Lake, we were not able to conduct all the classes in the timeline. According to the grant, it was supposed to be conducted during the semester, and we were not able to do that. And so I'm still in talks with Jamie Davis, who is the partner with this program, and we are planning of withholding the remaining payment to the mentors and the advocates at North Lake. But we will get the advocate surveys back. Hopefully that's helpful. Coming to the Living Well program, in the last few meetings, we had long discussions about the EOCC incentive measure, and Living Well program was our solution to tackle the diabetes poor control measure. And we are yet to hear back from EOCC. On March 1st, we'll be hearing if our proposal went through, and later in March, we'll be getting the grant dollars. And the training for the diabetes Living Well is not going to probably happen before April. But that's not why I've included this here. So in late January, we had a good meeting with representatives from Sky Lakes, who are going to provide us with the Living Well diabetes training regarding how we're going to go about that. So they informed us that there is another opportunity of chronic pain self-management workshops and trainings. And pain management is always high in the priority list for the clinic and the wellness center. So we contacted the directors of both the clinics, and they wanted our employees to also get trained for the chronic pain management program. So our facilitators who are gonna be trained, certified for diabetes, that is Francine Winters, the prevention coordinator, and Janine Sims, who is a licensed nurse. So they both again opted to get trained for the chronic pain management program, and the first half of the trainings is today and tomorrow. So right now probably they're getting trained.
Are they here or?
Medford.
Oh, they're in Medford.
Yeah. So we're gonna get them trained, and we got the go-ahead. And once they get certified, we'll have a more proper structure of how we want to go about with the chronic pain management workshops, or else we can utilize that. Coming to the Gatekeepers program.
Do you know the chronic pain management program at all?
No, I don't know.
Do you know anything about it?
First I heard.
It's part of that, the Stanford, that Living Well.
Oh, part of Living Well, it's a subset of it? Okay.
Mhm.
All right, I was just wondering whether it was evidence-based or whether it was coming out of
Oh, it is evidence.
the Oregon Health Authority.
If it's coming
or-
out of Stanford, it ought to be evidence.
Yeah, it is, so
Was it
I just hadn't heard of it before.
was it just offered to the clinics and not to like the
No, it's
nurses?
a community program.
So, Scott, if I understand it correctly, correct me if I'm wrong, Sky Lakes contracted to have Living Well. It's a big program through
With chronic
Stanford
illness.
for chronic illness. And they're extending a portion of it to us as
One of
part
my
of their
classmates
outreach. A big part.
One of my classmates, I think, was talking about that, the Living Well, because she's in Sky Lakes.
Oh, is that right?
But I was just wondering why, because I feel like that would be interesting or helpful for all the nurses on
Yeah.
that side. So I was just wondering why we didn't hear about it, or why we don't hear about it, or why we weren't offered.
Because you gotta teach the class 12 hours, 2 hours every 6 weeks.
Well, it still would be interesting to know about, I think.
Yeah.
When will we find out more about this chronic pain program?
So they'll be back this weekend, I'm guessing.
Yeah.
So we can.
So
even-
Francine and
Jenny.
Jenny,
Yeah.
then we
And
can find out more.
yeah, and in future, I can see to it that the information is spread about more. So we were told about this on January 27th or 26th, and we just immediately, because we didn't have much time, we had to coordinate sending them, and there's all this paperwork involved. But this program is, the certification is free. Usually it's not, but we are still finding out if they're going to cover all the expenses, like stay and mileage. So we didn't have much time, so we just contacted the directors, and yeah, probably next time we will let everyone know about it. That's the Living Well program. I'll keep you posted what happens with it. And the coming to the Gatekeepers program. So Christy in the last few CHIP meetings had informed us about the Gatekeepers program, and Laker District was awarded the Great Gatekeepers grant. And so I want to just mention where we are with it and how we're going about it. So in January, we had a very productive meeting with all the partners, other than Laker District, that is the senior center. Andrea was present. Klamath and Lake County's Council on Aging, they were present, and even Rod Howard is attached with the program. So we had a meeting on how we wanted to go about it and just give more structure to the program. So our timeline was so we have a plan of sending out surveys to seniors. So in our timeline, we wanted to prepare a survey in January, which we did. And now our next plan is in February, we wanted to send out the surveys to seniors in Lake County and also start with our media and advertising. And the survey involves just gathering information from the seniors regarding their mental and physical well-being, their access to healthcare, their access to services, if they are aware about the services provided in their community or counties. And our idea was to send out surveys, and depending on how many surveys are returned to us, we can establish a baseline about the information. And our plan was that at the end of the program, we'll resend the surveys and to the seniors, and then so that we can gauge the success of the program. And Yeah, so my plan is next week to send the surveys out, and the week after that to start with the media and advertising. And we have also been in touch with Lake County Examiner folks, and pretty soon they're working on an article will be published about gatekeepers shortly in the paper. And just to give you an idea again about what the Gatekeeper program was, it's a program to promote seniors' well-being, where we train community residents. After the training, they are called as gatekeepers, and the idea for the gatekeepers is that they can spot red flags, like if they can indicate a senior is struggling with health, abuse, finances, or other issues. And once gatekeepers spot that, they can either contact the senior center. We have senior navigator Noni Moss, who's also present here, or they can also contact the CHIP department, and we will then refer them to the appropriate agencies. And also why we feel this program can work is because in the last year or two, the senior navigator has scheduled 135 seniors for an assessment visit and directed those seniors to, depending on their needs, to social, nutrition, mental health, physical activity, transportation. So we just want to expand this model. So that's the Gatekeepers program.
I have a question for you. Will the seniors that we send out notices about, will they be able to access it from their, if they use a electronic device?
So we are planning to mail the surveys. So, because we don't expect, in our discussion, it was like, the seniors are not that techno savvy over here, so mailing is what we are leaning on. We wanted to incentivize the surveys, that if they fill out the survey and send it back, they will have some incentives, but we did not add that in our budget, so we are still working around that. And Rod Howard has some good ideas. He said that we should probably send them a letter before the survey, informing them that a survey is going to be sent to you. In his experience in the past, that has been very effective when it comes to survey returns. Yeah, so we are still.
I mean, ideally, that's how you want to do it. The survey methodology, there's a bunch of things that you can do to increase return. It's based on how much money you have. And I don't remember, Christie, if we budgeted that kind of stuff in the grant at all. I don't think so. It was a small amount, so.
It's like $10,000.
Yeah.
That's what I was thinking, if we could do it electronically. There are a lot of seniors that are pretty, some are not.
I saw the headline in the Lake Examiner. Our vendor says the seniors are.
But you know, a senior is someone 65 and older. There are a lot of 65 plus people that are very, very technological. And there are some that believe that 55 is considered to be senior.
Yeah.
So, you know, as you're thinking about that.
You know, 60.
We use 60 and older.
60. There's a lot of people over 60 that don't want to use computers, let me tell you.
There are a whole lot that don't. There are a whole lot that don't,
Yeah.
I'm not saying that there
because I
aren't.
see them.
Yeah.
I
Yeah.
understand that. But, you know, we want to try and utilize
Right.
people's skill set if they have.
But how do we get their emails? That was the tricky part, right?
Well, you know,
Speak on the addresses.
there's another one.
Addresses we.
One thing that we could do is if, with the help of the newspaper and the radio, we could say they could go to our website and click on the link. We don't need to take their email address because people don't want to get spam.
Yeah.
So we could say, go to our website, click on this, here's a place for the senior survey. You may get good results, you may not, but if you pick up more people.
You know, it wouldn't be it wouldn't be a big problem if you asked Rob, if we'd like to do that methodology, can you give us some money?
Well, definitely do that, and
Yeah.
No, seriously, I think that's a fair thing. I mean, I remember seeing the review. It was very, you guys are very prudent with the resources.
In fact, one of the things that we might even consider doing is rather than have them go to the hospital website, what if they went to the newspaper's website?
Yeah.
That increases traffic to the newspaper website. And, of course, I'm speaking of the newspaper, but what we do is create several things. It has people going to their website so they see how to use it
Yeah.
and access the survey, either or, for that matter.
And sending it electronically is gonna be way easier than the effort involved in mailing.
And as long as you can track it so you don't get duplicates.
Yeah.
But you could do that.
Yeah. Let's
Just a
work on that.
suggestion.
That's good.
Any more comments, or should
Well, actually, yeah, was a survey part of the Gatekeepers program?
That was how we were gonna measure it.
Oh, you're pre and post? Okay. I would have had referrals to none. Would have had 135 already.
We could probably have that many in a couple of weeks, lunch at the senior center.
But no, but I mean, obviously your folks are already trained to recognize those. This is for, you know, somebody.
The people that don't go.
At the Paisley store or bank somewhere and seeing somebody struggle with, you know, finance.
I think you're more likely to, honestly, I think you're more likely to get a better response from North Lake than you are from Lake County,
South Lake?
yes, other than, I'm at Lakeview, yes, but thank you. Than you are in town without follow-up too, and I don't know if that's written into it, but without calling them back or, you know, checking in on them, hey, remember that survey? Just because those people in town are, they're more likely honestly to bring it back
To the
than,
senior center?
yeah, than they are to mail it back. To send it back.
That's an option. Yeah, we put up a, and if we maybe did the same thing in Paisley, in North Lake, at, you know, some designated place where people could put their survey in, either at the post office, at the senior center, at
To the library.
the library, places where people go, so that it makes it easier for them. Same thing in Blush. Blush and, yeah.
In the proposal, we have trainings scheduled in Paisley and other towns, so yeah, we can. And the gatekeeper trainings, we were aiming for March, we're still aiming for March, but we have to hear back from the ADRC, what is it? So there is this agency that's going to provide the gatekeeper trainings, and so we have to coordinate with them. So I'm looking for sometime in March or early April for the trainings to start. Yeah.
That's the AAA, right?
Yeah.
Yeah.
Kim Estes.
And Myra.
Kim, again, we are working with Kim on the Living Well program. Coming to the food court updates, Rochelle, can you give us some updates?
Sure, yeah, so, yeah, I continue to teach. I've added a few more classes since our last meeting, so, yeah, it's been definitely taking up a good amount of time doing lesson planning. But it's going well. I think kids are really responsive, and so, yeah, I think, the lessons continue to be making an impact, which I feel good about.
What grades are you teaching predominantly?
Well, I teach K through 4th predominantly. I've got 2 second graders in town, or 2 second grade classes in town, 1/3, 2 4th, and then all the classes are Union, and then Plush. Oh, and then I've got Miss Hicks in town, little kindergarten in town. So yeah, but yeah, K through 4th. So yeah, it's definitely no contact with middle school, high school, which I don't know if that's something that's in like the scope. of what's possible, but anyhow, yeah, we're actually, speaking of second and third grade, we're having a grub club next week with the OSU Extension, so we're gonna be doing 3 days of after-school club, kind of like piloting this project to see if we get interest from the kids, and just, yeah, trying to kind of engage them outside of the classroom in nutrition and cooking lessons and just hands-on working with food, healthy eating. Got some taste tests coming up. We've got a beet-related taste test in town that's gonna be coming up in a few weeks.
How
So
did kale chips go?
it went well. Yeah, it was really good. I had the teachers like announce it before, and so all the kids at Union came into the cafeteria and like teacher said we have to try it. So like every kid, actually, I'm pretty sure every kid, maybe minus like 1 or 2, took at least a taste. Most kids were receptive. I don't have like the numbers, but yeah, overall definitely successful. Gave out stickers, which I think also was a good incentive. Yeah, turned out well. I attended a week-long conference like late January with Food Corps. So that was helpful, shedding light on, I guess it's required for schools to have a wellness policy in place, I think by the end of the school year. So we were talking about that and like strategies for getting those implemented. I believe the schools currently have a wellness policy in place for the staff, but not for the students. So gonna be looking to partner, or, you know, discuss that with the administration. Yeah. Oh, actually, the gardens are like slowly moving forward. So I've been working with Amanda O'Brien, the garden coordinator at Union, to get seeds, like special seed varieties that are going to be successful in this climate. So we're going to get those ordered in the next week or so. Also, fruit trees.
Where are you going to plant them?
So there's going to be the fruit trees specifically, or there's going to be a small garden here in town at Fremont, just like part of that field right next to the playground. And then out at Union, they just, yeah, they'll have the greenhouse. And then, yeah, both schools are supposed to have little areas with like benches, maybe like a teaching board, so kind of like an outdoor classroom. And within that, there'll be like some fruit trees providing shade for the tables. Yeah. So if it keeps raining, I mean, we might have construction on the gardens before we know it. So that could be cool.
It might snow.
Yeah, that'll be hope.
Memorial Day. It'll still snow.
Thank you, Rochelle. Christy, can you give us the grant updates?
Yeah, so we submitted 3 chip-related grants last week, proposals. One was the Outback Strong pitch, the one that encompassed the developmental screenings, diabetes, and contraceptive care. And we applied for an opt-in grant, specifically with clinics related to colorectal cancer screening, where a third-party vendor is going to handle mailing out the fit tests that you actually do the screenings through, and they will handle contacting patients. We have to supply the letterhead the clinics do, the letterhead that they will send out these mailings on behalf of the clinics, the phone calls on behalf of the clinics, and basically all we have to do is ensure that the tests that come in get tested, and that people who need follow-up get the appropriate follow-up. And we also applied for the opt-in program with the health fair, partnering with the high school and public health and clinics, and who else, there are a lot of partners involved in that one. And March 1st, that's what I have in my head, is when we're supposed to find out, is that somewhere around there is when we're supposed to know whether we've been selected.
Yes.
Somewhere.
Well, we don't have the board meeting set yet for February, but the committee that's reviewing and approving all of the grants is supposed to be done by February 16th.
Awesome. It's a pretty good turnaround.
Well, the timing on this whole thing always stings, Christy. I mean, we're already 2 months into 2017. We don't even know if we've met the 2016 measures yet.
Yeah.
So that money won't be available till June. But our board of directors at the last meeting, were you not there? Okay, well, at the last meeting, basically said LCACs now get 6% of the incentive dollars that we get back. So you guys can pretty much count on, you know, having a program similar to this so that you can begin to plan earlier and it's not like a big rush.
Well, but we also don't know how much is gonna be allocated overall to all of the, community advisory councils. And then we don't know the total dollar amount, we can guess. But it gives us a little bit more planning.
Yeah, but I mean, you can figure a small increase like you saw from this year to last year to this year, whatever it was. Probably five grand more, maybe it was a little bit more than that. But anyway, know that we understood the timelines.
Honestly, for that, the schools, that was the biggest, because you don't talk to the schools in December, because that's just
Right.
insane. And then in January, that's the end of the semester, so it's just, that was a little rush for the health fair piece, but
Right.
it's fine. We're getting everything hammered out.
Right, and the health fair piece is addressing the adolescent well visits.
Yes. That's it in a nutshell.
What's the one on chronic pain that you were looking at with opioid reduction?
So that is something that I'm working on with the clinics. Dayla's not here, I haven't told them about this yet. It's through Cardinal Health Foundation, and we already have, we got all the providers, local providers have signed on, they've got this contract that all of the providers are using, that the patients go through and they sign, and.
Oh, the opioid contract, yeah,
So
that's pretty common.
We're already using that, got everybody on board with that, so we're gonna springboard off of that and try to get additional training and additional whatever we need so that we're moving away from the prescription and moving towards the chronic pain management, yoga, whatever else is, that wasn't one that was approved to be covered, but all those things that you mentioned
Right.
last week.
Okay.
Those things.
Coming to the EOCCO.
Before we do that, for chip updates, not gonna put Beth on the firing squad just yet, if she has any updates, but maybe we can ask Mindy if she can give us an oral health update. Mindy, you still there?
Come off mute, Mindy.
Hey Mindy, are you there? Probably not.
Okay, well, Beth, do you have anything that public health is doing?
We just done a soft start with the ASQs, so we're, started that program. Dr. Graham's patient, or Dr. Graham wants his patients to see him for that. So when people come for immunizations, so I think the first day we started it, out of 7, we had, I'm not sure about these numbers exactly, but it was, most of them were Dr. Graham's patients, and 5 of them were. So it was a very soft start, but we're working on that now. We have the toys, so we've got that started. We're scheduling that, so that's our thing with that. I've just been coordinating with Christy a little bit on some of this grant writing and, yeah.
Great.
One more to get one. Okay.
I was on the clinical advisory panel meeting yesterday, and at the meeting prior to this one, we were over at the senior center. You had asked about how they're doing the immunization numbers, and so the Asher Clinic is actually in Wheeler County. Public Health is right there with them doing, information, and the report that they got back on the 2-year, people who turned 2 during that calendar year, they went into their own records and looked, and it did not match up very well with a small number of people. And it was like, they said there were 10 2-year-olds that the clinic had seen, and 8 of them were not, and they had 9 that they had fully immunized,
Yeah.
and 1 that didn't. So something's going on
Okay.
with the alert reporting system. That's, because you were saying the numbers didn't look right for what we were seeing for Lake County. So people are looking into it.
Okay, good.
That's a state reporting program, right?
But
And what you report should go to the state, and it should come to the CCO.
We get the data from Alert. So, I mean, Alert is the centralized, the whole idea of Alert was a kid moves from Lakeview to Enterprise and their records don't follow them for immunization. So then Liz Powers looks at this kid, she's the doc up there, says, I gotta start him on the whole regime again. You know, where now it's a central database that anybody can access for any kid for immunization. So if they're bouncing around to different service providers, you ought to be able to go in there and look and see that the child has already had their, you know, series of whatever, but the reporting is just not, something's not happening.
Sorry, Manager. Coming to the EOCCO incentive measure updates, the last few meetings we have had long discussions about the EOCCO incentive measures, and I don't want to take up any more of your time discussing that. However, we discussed in detail the non-competitive grants, and so there were also the competitive opt-in grants that were offered, and Christy also applied for two others, as she already mentioned. One is the adolescent well-care visit health fair, and the other we have opted in for is the colorectal cancer screening. And we have to see here if, it all depends if they award us these grants. However, we started some work on them. So for the health fair, I wanted to give you an update. So last week, we had a productive meeting with the school district officials. We had Mr. Will Cady was there at the meeting, and also the principals, Jesse Hamilton and Susan Warner, and Bobby Steninger. I'm going to stick with Bobby. And so she has always spearheaded the sports physicals for students for decades now. So we definitely needed her guidance. So in the meeting, we gave more structure to the health fair. I and Bobby are going to work to create a consent form before the health fair, which will also give an in-depth detail information about the health fair. And so the way Bobby conducts the physicals is she goes from classroom to classroom, and she's also a teacher, right? And she does the physicals for the students, and so she's going to remind them about the health fair and also inform them that there's going to be a health fair, and also attend that. Then we are also working with the school district for the advertising and media. We're going to have posters put up and flyers distributed all over the schools and also in the communities, the community. And we're also going to advertise in local newspapers and radio station spots. And so in the meeting, up till now, again, it all depends on if we are awarded the grant. So whatever we have planned may get modified in the future, but up till now, the structure that we formed is, so we still don't know, we don't know if we are going to conduct the health fair in just one area like the gym at ADA, or we're going to have the fair in both the schools. We're still working on finalizing that. But the idea was we'll have a health fair, for example, in the gym, and then we're going to have certain stalls or stations, like one station for adolescent welfare visit, one for depression screening, one for drug and alcohol misuse or cigarette smoking prevention, and we have contacted all the people that will be involved for each station. And yeah, we have even immunization and contraception education. We don't know if we're going to keep all the stations yet, but this is the rough idea how we want to go about it. And the idea is to the students, now again the health fair is going to be for children in grade 5 through grade 12. And our plan was to hand out a passport to each student, and the idea is that they go to each station, they get a stamp, and if they get all the stamps on the station, they have a chance to win a bike for boys and a bike for girls. And a pool pass. But at the same time, it will be, now another thing which we haven't decided yet upon is, earlier we were planning to, we wanted the Bobby's physicals to be conducted on the same day as the health fair. But then on discussion, we also thought it might be better if the physicals are done a day before the health fair. And so we still haven't decided on that yet. And another point that was brought up is from grade 5 through grade 12, it's close to 350 students. So it's going to be chaotic. So we have to plan, because for each station it's going to take some time for the student to get screened. So what are the rest of them going to do? So we had some ideas of some distractions for them to do something on the side. One great idea Christy came up with is a blender bike.
That was bad.
Oh, that was bad. Can you give us the details what the blender bike is?
You pedal and it makes a smoothie, that's really all I know, but it sounds cool, then we'll just have it, I assume here, for our use.
Where do we find these bicycles?
Jamie Davis had the link, his OSU has a couple of them around the state, so she sent me the link.
You pedal and it creates
A smoothie, yeah, you pedal and it spins the motor and.
It's a blender on it, you're just generating electricity.
See, you never knew that you always wanted one, that you always wanted one.
Charlie's is gonna be real chunky. It's not gonna
Yeah, so we're going to encourage students towards green energy through the blender bike. And yeah, so we're also working on how to keep them busy until their turn comes to visit the stations. And then another piece that we are still working on is, so after they go to each station, the final step is going to the providers, because that's the most important step. They need the provider sign, and also that's going to help us with the EOCCO billing process, which is very important. So one of the ideas was the clinics are like 4 blocks away from the school. So one idea was after they're done with each station, we take them to the clinic. How we want to do that, we haven't decided yet. But because that'll be easier for the providers, their whole teams are there, the process will be more efficient. But if that doesn't work out, then we'll probably get the providers with their teams to the classrooms and get that last bit done. And we have already spoken with the directors of both the clinics, Warner Mountain Medical and Lake Health, and they have given their assurance that they will clear the providers' schedule for that day.
Did you pick it?
So it's tentative, but it's going to be in June.
It was before 6th grade field trip, wasn't it?
I can't remember.
But Bobby's physicals is always like a set date, right? So I think it was early June sometime.
That's during school.
Bobby said.
Yeah.
It'd be during school. School's not out till June 15th this year.
So we would, I can't imagine that the school would want to have kids having the opportunity all over town. So I would think that the more that you keep the kids on campus would be safer and more effective for them.
We wrote the grant to go, because the providers really, the ease of the billing primarily, and for more privacy and more time with the kids. We're hoping that the kids can walk to 4 blocks, but they're kids, and there are a lot of escape routes along those 4 blocks. So we wrote the grant to go either way while we kind of figure out logistically what it needs to look like.
I think on the health fair, I talked to my administrative team, we kept talking about where to do it, and I finally proposed kind of a neutral location, a school district. We thought Daly Middle School would cause the least amount of interruptions.
Cool.
At the elementary, you have the gym / cafeteria down there. At the high school, that gym is just going all day long with this and that. And Daly Middle School would be, hardly impacted at all. It would be less impact than the other facilities. So probably Daly Middle School is kind of that gym at Daly Middle School is kind of our untapped school of thought.
So I'm sure you guys have worked some of this stuff out, but, a licensed clinician needs to provide the physical. So Bobby's Scholastic Sports Association physical is not the same components as an adolescent well visit.
Right.
So when they go to that country or station for their passport, I mean, someone from the Center for Wellness is doing the screenings for mental health, correct?
Yeah, I have a list if you.
Okay, as long, it's licensed people all around, it's not, okay, because I wasn't hearing that, and want to make sure, because then the providers really can't accept those screens and,
It has to be licensed.
yeah.
It also seems like if you're doing all the way from 5th to 12th grade, you would want to do like maybe 2 days with different, like a 5th grade of contraceptives is not going to be what you want to teach a 12th grade. Like, they're not going to be the same thing, and it seems like you would want to have different information for the different age ranges, that maybe 2 days would make things also go smoother, that you would have like everything for the specific reading levels or whatever, I don't know.
Yeah, in our meeting, we did discuss, when it came to the contraception booth, definitely the information is going to be different for different grades.
Also, I can't remember what we talked about for students. You were all over that piece.
Yeah, I mean, we can decide, but you can do a piece on setting goals, or, you know, there's abstinence education, and there's, there's just how to keep your body safe. I think Baker County did a lot of coercion information, actually, in their reproductive health, that portion.
And as they're going in stations, aren't they gonna be like, are you thinking like they're gonna be in small groups going into each one?
I don't know, I'm thinking individuals.
One-on-one.
We were thinking individuals, yeah.
Because then that would kind of eliminate the whole, you know, you
Yeah.
just base it off of which age you're talking to as
Yeah.
opposed to
Yeah.
just them all over general.
And also the EOCCO incentive measure targets women between 18 to 50. That's written in the report. So, but the idea was that even if younger children, we give that information, that will help them.
You're talking about effective contraceptive use?
I'm thinking long-term here.
Yeah, those are two different measures. The adolescent well visit introduces the whole idea that you're talking to your provider about human sexuality. Once you're 18 to 50 as a female, then we need, you know, that there, to verify that there is an effective contraceptive in place.
Okay. Yeah. And I'll give you the names of who all we have contacted for the stations. For the depression and drug and alcohol misuse, we contacted mental health professionals Heidi Martinez and Jennifer. I don't know how to pronounce the last name. And for the drug, alcohol and tobacco prevention, Francine Winters, our prevention coordinator, is going to take care of that station. Beth Hadley, we have spoken with Beth Hadley about contraception, as we all know. And for the, we might have an immunization records station, and we have a nurse, Julie Clark, who's also from public health. So yeah, and the work is in progress. Is there anything else?
So at the fair, are you also gonna have like Mindy there at the table doing on-site screenings and stuff like that, and have other providers?
So the last meeting we had, we did not discuss that. But yeah, and also I tried to get in touch with Mindy, but she was on vacation till late January.
Yeah.
But now she's back. And yeah, so I'll speak to her about it.
Okay, because I know the hygienists that we work with in Delaware County, they do a fair in each of their communities. They do 7 over the course of the spring. And the hygienist there sets up a table, she has toothbrush kits she gives out, and on site she says, hey mom, do you want to sign this? She could do a screening, and she does them right there. So then that would also go toward your.
She does a varnish right there.
Yep.
So, I think the idea of this though is the parents won't be there with them, but maybe they could do permission slips ahead of time
Well,
if they want to do varnish.
and the older kids, you or maybe only have to be 15.
Yeah.
You can sign your own consent form, so. But I mean, even just to have her there giving out, information and toothbrush kit.
Yeah,
I'm
but if
sure
they
she
could do
would
varnish,
do
it'd be
that.
good.
Mhm.
Yeah. And we are gonna give them consent forms before the fair,
Yeah.
so we can definitely add that. If anybody has any suggestions, as you mentioned earlier, we were planning to do it in one day, the whole health fair, but then it seemed like it'd be too taxing for the children. If they're gonna get their physicals done, then they have to be present for the fair and then go to the providers' clinics. So that's why so that's still, yeah, if anybody has any suggestions, what do you think might be right? So for now, I think we are leaning more towards splitting it into 2 days. Then we can probably also do it into 3 days. Because Baker County does 3 days, if I'm not mistaken, on which we are the model that we are replicating on.
Are they in a row or are they just once a week?
They did it 3 days, like a Wednesday
Together.
and Friday. They didn't do it at school, they did it at
Park.
one of the clinics, so.
Or clinic?
No, they did it at the park.
No, they said there were 2 separate events. There was like the fun fair that just happened to take place around the same time as the actual event that they did. Because I thought it was all the same event. And when I talked with the public health lady, Nancy's husband, she said they just happened to coincide timing wise. And they used one to advertise for the other.
Right, and the school-based health clinic billed the services there, which made it real convenient. Because it's run by public health there.
And also on the idea of making the kids walk to the clinic, that doesn't seem feasible. Any suggestions on that?
Are you thinking like during the school day, where the kids go from the school to the clinic? Is that, because,
We still haven't decided on the date yet.
because can you have a 5th grader go to the clinic without their parent present?
I think it's still being fleshed out, isn't it, guys?
Yeah.
You know, we've been doing it, we've been having the doctors come to the school for years and years and years, and Bobby's got a pretty good handle on it, but we're still trying to wrap our brain around it. We hadn't come to complete agreement on that yet. So,
Unfortunately, one of the things that happens when the docs come to or practitioners come to the school is they don't do as robust of an evaluation. And part of this is about doing as robust as the CCO requires. And that's how do we make it more robust and still either and make it as convenient as we can to the kids.
can you define robust?
All of those stations, plus the physical, must be part of an adolescent well care visit for it to get credit.
That's what I mean when I say robust.
As
Otherwise,
opposed to we're listening to your heart checking for a hernia, doing an eye check and saying you're
But the
good to play,
doctors aren't gonna
good to play
repeat what was
sports.
already done in the stations.
Right.
No,
So
no.
they're gonna take that information.
they're just gonna take that information and review it with the team. So I think it's.
We just need to figure out a plan. We
On-site
just-
with the laptop.
Need to figure out a plan as to how to herd them down here in an orderly manner.
well, there's another option, and that is we contract with the school to use a bus. And just bus them back.
Yeah,
Something like that,
yeah.
so that we're protecting them, we get them to one place to the other, that we don't have mass confusion
Yeah, and the big thing is the supervision piece too.
and supervision. We can't, I mean, we're not gonna let this be free-for-all.
How much did you put in for that one? Did you go for all 50?
It was just us, because we could not get any of the other schools on board, so no, we went for about half, it's about 25, I think, what we asked for.
Yeah, 21,440.
Not quite 20.
Going to the next opt-in grant, which is the colorectal cancer screening. Warner Mountain Medical and Lake Health Clinic are on board with that incentive, not incentive measure, grant. And how this, again, it depends on if we get awarded the grant. How this one works is, as Christy mentioned earlier, they are going to provide us with fit kits, fecal immunochemical, and they are also going to provide us with a list of people we should mail them to. And we have got in touch with the clinical staff of both the clinics. And for Warner Mountain Medical, they're gonna see we have got the staff has told us that they will they will provide the proper letterhead and the physician's signatures and all that is necessary to complete the fit mailings. And also Modern Medical has, I guess they have their own in-house laboratory, so it's an easier process for them. And they have told us they will send the results to the patients and also do a follow-up. For Lake Hill District, we got Janine Sims again. She said she will see to it that all the test kits are taken to the laboratory, and then again the results are mailed and follow up. So yeah, so that's how the colorectal cancer screening is going.
What about the Lapine Club?
We spoke with them in January, but we did not get there. Do you remember any particular conversation? Yeah, they are not interested.
I can tell you this, there were only 4 that opted in for the colorectal cancer.
It's a tough one, not everybody finds it easy to talk about.
Well, that, and I think you had to get a clinic. And not, clinics aren't always well represented on LTACs. I mean, that's who's getting the money, the clinic, not the CAC.
Well, that's all for the chip updates.
Paul, do you want to talk about the waiver?
Yeah, on the back of the materials that our vendor sent, I'll be quick. People have been asking a lot of questions about what's happening with the Medicaid program with the new administration in DC. You should be aware that about 8 days or 9 days before the inauguration, the state of Oregon was able to get an agreement with the Center for Medicare and Medicaid Services to continue the Oregon health plan as the alternative waiver that we do called coordinated care organizations. So coordinated care organizations are going to be in place just the way that they have been for the next 5 years. We have that agreement in place. The question becomes, who's going to be a member of the Oregon Health Plan? Right now, it's really up to the Oregon legislature to fill the $1.7 billion budget deficit, a big hole of which is caused by the expansion program. So we had the pure Medicaid population, then the Affordable Care Act was enacted, and you had a group of people who became eligible for Medicaid that weren't before. And then you had a group of people that were required to purchase insurance with a subsidy, and if they didn't get the subsidy, they were taxed and fined for it, right? So really the administration and the Republican, they're focused on the, that the government would make you get insurance. Not the eligibility piece that says we're expanding Medicaid to cover more people. So that's in place, but it's up to Oregon to fund the difference between that. When the expansion happened, the feds picked it all up. They were 100% of the cost was covered by the federal government. Each year afterwards, a certain percentage gets ratcheted down to where they're only covering 90% of the cost for that population. So it's really up to what our legislature does right now as to how many people will be part of that expansion coverage. The original waiver that we talked about, and we had over at the meeting at the senior center when we talked about housing, we have more information on social determinants of health, transportation, food security, housing. Originally, the health authority wanted us to be able to do a lot of that stuff. And once the election happened, they scaled it back to be able to get the agreement. So there's no requirement right now that coordinated care organizations be in the housing business. But I can tell you that Gobi, as a member and owner of the COCC, is already has about $3 million that they're looking for partnerships to do housing as part of it in anticipation of 5 years from now, because we got issues with housing in Eastern Oregon, so we're still doing that. One of the things that we must do now, and it'll affect your claims, Charlie, and Warner Mountain as well, is, and up in Christmas Valley, we must have more value-based purchasing. And so at the board meeting that you saw in January, there was approval that 2/3 of the quality distribution pool would be distributed based on whether the clinic meets the incentive measures or not. At first, there was no requirement. If you had certain people assigned to you, we sent you a check. Second, it was just 1/3. Next year, it's 2/3. And in 2018, the incentive measures, all of the dollars will be distributed based on outcomes. You know, as far as the quality distribution pool. That's the only big change, but you can, you know, it's a little 2-page document there. Just wanted to make sure that you knew Medicaid is not going away, no matter what happens. We're still gonna have a Medicaid program.
Just how big is it?
It's just how big it's gonna be. So our work is still in front of us for not only the EOCCO as a CAC, but for your community as a whole. No matter what happens, we still have ways to create a healthy community. And that's why you're all here. That's it, Charlie. Any questions?
How about other issues that people would like to bring up, talk about? We have a lot on the plate that we're doing. We appreciate all of you are to help make this happen. Those that came a little bit late, did you want to add anything else? If we had such a robust conversation going, everybody looks at the clock and says, 4 o'clock, I want to go. I would recommend that we adjourn. The next meeting will be in March on the 9th. So, mark your calendar.
We should have a lot of information, news.
Does 3 o'clock work okay? So we'll change from 3:30.
That's a very good time, I think. That's me though. I think break down the rest of the group.
Free work. And I'll try to give you guys heads up when I know stuff too, but it won't be official until our board meetings.
Yeah. I should, and would like to thank everyone that I stalked / harassed to get the information for this, so thank you everyone for putting up with my phone call.
Thank you,
I
everyone.
promise not to use your cell phone.
We are adjourned.
Thank you.
Thank you.